this is Handsome Nerd ASMR back with another video. In this video, we're going to be learning about the bacteria called Clostridium difficile. So, obviously, this bacteria belongs in the genus Clostridium and the species difficile. We're going to be using the sketchy image to learn more about this bacteria. The image is titled "The Field Trip to the Chocolate Factory." So just think about Willy Wonka and his chocolate factory. And so, some general features are that the bacteria is a gram-positive rods. So think about the violet hat that these workers are wearing. They're also spore-forming, so think about the walnuts and the conveyor belt shown over here. They are also obligate anaerobe, just like the Clostridium, botulinum, and so that's why these workers are wearing the gas masks. And if a reservoir, you'll mostly find them in the human colon and the gastrointestinal tract, and the transmission is through the fecal and oral route. So, regarding its pathogenesis, there are two toxins produced by this bacteria. The first toxin is called toxin A. So think about the sign that says A for apple over here. It is an enterotoxin that damages the brush border mucosa, which leads to the fluid increase in that mucosal space. And so think about the worker brushing on the chocolate diarrhea to represent the brush border. So let's find that worker. I'm guessing it's right over here, or maybe it's this worker here. Okay, let's just pretend that this worker has a paintbrush. That's supposed to remind you of the mucosal brush border. And this is what toxin A damages. So it is also a granulocyte attractant. Toxin B. So this one, you can think about B for black licorice, as shown over here. So toxin B is a cytotoxin, and so it is cytopathic. The way it works is that it will disrupt the cytoskeleton integrity by depolymerizing actin. You can remember this by thinking of the child eating the licorice, which looks like the actin. And then, let me just fix that for you over here. Which looks like the actin. But anyways, looks like it's that child over there. That can help you to remember that the toxin B will depolymerize the actin and ultimately disrupt the cytoskeleton integrity. So this will cause the enterocyte death and necrosis and buildup of a yellow-gray exudate that forms a pseudomembrane that ultimately covers the colonic mucosa. So this condition is actually called the pseudomembranous colitis. So you can remember that by thinking of the yellow-gray candy on the conveyor, as shown over here. So that helps you to remember the pseudomembranous colitis. So for diseases, it can be caused by antibiotic-associated, or it can cause antibiotic-associated diarrhea, colitis, or pseudomembranous colitis. And the initiating antibiotic is typically clindamycin that can cause these conditions. in severe cases, treat with metronidazole. So once again, think of the metro train over here. Or you can use oral vancomycin. So let's look for that vancomycin with the tongue-shaped loading ramp. Once again, we have the vancomycin over here. Take a look at this loading ramp. It is tongue-shaped, so you can remember that and think about the oral vancomycin as another plausible treatment. But oral vancomycin should be used only if no other drug is available. And so once again, remember that vancomycin is not absorbed, so given orally it will stay in the GI tract. And then an alternative specialist drug should be considered, like fidaxomicin. And then in the nursing home setting, patients who are symptomatic should be isolated, and the bedpans that they were originally lying on should be autoclaved for treatment that kills spores. And then of course, hand wash diligently. So look for that clean hand washing sign. And this is one of these bacteria that those antibacterial or hand sanitizers are not sufficient. Instead, hand wash is necessary. So always think about that, especially if you're a healthcare worker. So, before I conclude this video, let me just fix this typo over here. And then, yeah, that's that for Clostridium difficile. It may be a difficult bacteria, hence the name difficile, but it can be managed simply through discontinuation of the antibiotic therapy in mild cases. So I hope you found this video to be informational and at the very least relaxing. Feel free to comment down below any other information that needs to be covered or that was missed, or any clarifications that need to be made. Other than that, I hope to be back with more ASMR videos like this. Please like and subscribe for more of such ASMR videos, and most importantly, please take care and stay well.